Hello, glad to be with you again from Unified Oski. It's one of your nurses here. Thanks for all the likes, subscriptions, and your support. Yeah, without wasting your time in this video, we want to have a look at the use of the pre-filled pen insulin in your NMC UK or SKI exam. Are you ready? Let's get started.
Before you begin your station, ensure you complete your safety check, hand hygiene, and provide privacy. Gain your patient consent and confirm their identity, cross-checking with the ID band and documents, ensuring your patient is comfortable.
As I approach the scene, I can confirm the scene is safe to approach. There is nothing to cause harm to myself or my patient. I ensure privacy is provided by pulling the curtain. It's not an imaginary curtain. I put an ampoule of gel and I do my hand hygiene in line with WHO standard. Allow my hands to dry for 30 seconds as I approach my patient. Hiya.
Hi, nurse.
Yeah, my name is Ademola. I'm your attending nurse for today. I'm here to give your due insulin at 18th hour. Is it a good time to do that?
Yes, nurse.
Perfect. But before I go ahead, I would like to confirm your full name and date of birth as I cross check with the document I have with me and your ID band. Can you tell me your full name and date of birth, please?
It's James Bond,
Per-
260943.
Perfect. I've got that on my document and I can see James Bond 260943 on your ID band. Can you tell me your first line of address and postcode, please?
It's Second Long Street, NN2 7AL.
Perfect. I've got that on my document. And your hospital number is 123456. What would you like to be called?
James is alright.
Okay, perfect. James, have you got any allergy to food, drug, or latex?
Yes, I'm allergic to metformin.
Oh, I can see you've got a red wristband saying you're allergic to metformin, and that is well documented on my document as well. And what reaction do you get when you're exposed to metformin?
I get rashes on my skin.
Oh, sorry to hear that, but it's good to know. I want to assure you we're not going to give you anything that contains metformin, and the entire team is aware about that. Yeah. Are you comfortable or are you in any form of pain?
I'm comfortable. Read the patient's prescription, ensuring that all rights of medications are checked. Confirm it is valid, legible, and complete. State the action, side effects of insulin. Confirm the blood glucose is normal before giving your medication.
Hiya, James. Is it okay to read through the prescription with you?
Yes, nurse.
Okay, I've got with me James Bond, 2 Long Street, NN27AL, date of birth 260943. The drug name is insulin glargine, dose is 16 units, route is subcutaneous, frequency is OD, time is 18th hour, allergy to metformin with rashes, duly signed by Dr. John Adams, GMC 437, date is today. This prescription is legible, valid, and complete. James, just to let you know, insulin is an hormone and it helps to utilize the glucose in your body to produce some energy. The some of the side effects which you may experience and you may not experience. The common side effect is hypoglycemia and sometimes lumpy fat around the areas of your skin. That is if you do not rotate the side. So, like I said, it may happen and it may not happen. Are you still happy for me to go ahead?
Yes, nurse.
Okay, and I'll be here to check you after 30 minutes to be sure you're not experiencing any side effect. Assessor, please, can I confirm James' blood glucose level?
Within therapeutic range.
Okay, perfect. James, I will be leaving you just for a few minutes to get the items. If you need anything, just give me a shout and I'll be right back. Is that okay?
Yes, nurse.
Perfect. Do my hand hygiene. Assessor, can I confirm that my tray is cleaned with soap and water and also cleaned with cleaner wipes and is ready for use?
Yes.
Okay. Yeah, so I've got the insulin, comparing it with my prescription. I've got Lantus insulin, 100 units per ml. I can confirm it's the right medication. It is meant for James, not to be shared, and it's labeled with James Bond. It is opened 18/1/25 and is valid within 28 days. So this can be used within 28 days. So I'm happy it's the right prescription, it's the right medication. I've got with me the gauze. This is it's I might need it, I might not need it, but I will just take it along. Confirming the validity is not expired. Expiry date is 2029. I have two alcohol wipes and expiry date is 2029. It's in date, it's not open. And I have the needle. The needle is single use, not to be reused. And the expiry date is written at the side. It says 2029. It's okay, valid. Okay. I'm taking a pair of gloves, which is in dates and not expired. And I'll be going back to James. A quick hand hygiene. Hi, James.
Hi, nurse.
Yeah, I'm back, like I said. Before I go ahead, can you confirm your name and date of birth with me again, please?
It's James Bond, 260943.
Perfect. And what did you say you are allergic to?
It's metformin.
And what's the reaction?
I get rashes.
Okay, are you comfortable?
Yes, nurse.
Perfect. So I'm here with your insulin now. Looking at the site, where did you have the insulin the last time? You told me you had it on the right side.
Yes, nurse.
Perfect. So I will be using the left side. Is that okay?
Yes, nurse.
And looking at the skin surrounding the areas, there's no any form of edema, there's no infection or inflammation, there's no any form of lesion, and the skin surrounding the area is clean. Okay, if the skin is visibly soiled or looks dirty, I will need to clean it. But since it's clean, I'm not going to clean it. Is that okay?
Yes, nurse.
Okay. So I removed the cap from the pre-filled pen insulin. The Lantus is a clear insulin, but sometimes you have other type of insulin that are cloudy. If you have a cloudy one, you may need to just roll it in the palm of your hand for 1 minute. That will be fine. 1 minute is equivalent to like about 10 times. But this is clear, it's soluble. There's no any form of sediments. I'm happy to use it. So I'm using my alcohol wipes. This is optional. Just go in line with whatever the marking criteria says about this. But I'm just cleaning the tips and this goes into the clinical waste. I'm leaving it here, but it goes into clinical waste as soon as I'm done. And here is my needle. I removed the tape cover covering the needle. This goes in the clinical waste as well. I screw this clockwise until it stops moving. I remove the cap cover. I need to prime and let out the air with 2 units. So I dial this to 2 and press and make sure there is a drop that comes from the needle, and that's the priming. If there is no drop, I dial it again to 2 and repeat the process. Now I'm going to dial to the prescribed insulin units, and that is 16 units. So I just turn the dial to 16. And you need to be careful with this to make sure it's the accurate dose prescribed for your patient. Okay, now I've got 16, so I'm happy to go ahead. The needle is very short, so I don't really need to pinch the skin because the needle is very short, and this gives an assurance that goes into the subcutaneous fat and not intramuscular. But if the patient is a thin patient, you might be you might need to pinch the skin, but I'm not pinching the skin. I'm going at right angle, which is angle 90-degree. Just take a deep breath for me, a sharp scratch. Okay. I'll give it over 10 seconds. 1, 2, 3, 4, 5, 7, 8, 9, 10. And I leave it for 10 seconds. 10, 8, 6, 4, 2, 0. I remove it. Okay, so I remove the needle. Okay, this has a safety lock, but some needle doesn't have a safety lock. So if it has this type of safety lock, just push it up, and that's the safety lock activated. Then unscrew this anti-clockwise, and this goes into the sharp bin. And even if it doesn't have a safety lock, as soon as you finish injecting, just unscrew it, and that goes into the sharp box. I cover this. It can be stored at room temperature. Insulin taken from the fridge should not be injected directly. Give it some time, like 20 to 30 minutes at room temperature. This can be stored at room temperature away from any form of light or heat, and that will be fine. Okay, that will be all for now. I remove my gloves. This goes into the clinical waste. My apron goes into the clinical waste. A quick hand hygiene. I will make sure everything I've used is cleaned and make ready for the next use. Everything is discarded into the clinical waste. My tray is clean and make ready for the next use. James, just give me a few seconds to document what I've done, and I'll be right back. Is that okay with you?
Yes, nurse.
Okay. I will sign my signature, today's date, and the name of the nurse administering medication. I'll put my name. The base is community units, and put my signature. And that will be all. James, I'm back.
Hi, nurse.
Are you okay?
Yes, nurse.
Oh, perfect. Are you comfortable?
Yes, nurse.
Yeah, you can have your meal now, okay? And if there's any form of hypoglycemia you notice, like shakiness, feeling pale, dizziness, blood vision, just take an orange juice, a glucose boost, just to boost your glucose. And if there's any form of emergency, you can always call your 999. Is that okay?
Yes, nurse.
So I'll be leaving you for now. If you have anything, you can call your GP. You've got your GP number. And if there's any emergency, you dial 999, just like I said. Do you have any question for me?
No, I'm okay, nurse.
Okay, thank you for your time. So see you tomorrow when you do for your next insulin. Bye for now. And that's it. Wishing you success. Bye.